Hello, welcome to Assessment 3 for Functional Anatomy SPE 262. My name is Tennille Stubbs. My student number is S379646. This assessment is split into two parts. So part 1 is the muscle length tests of 3 chosen joints. The first joint that I will do is the shoulder joint, and I have chosen to do the serratus anterior. The serratus anterior is a fan-shaped muscle. Its main part lies deep under the scapula and the pectoral muscles. It acts on the scapula and is the prime mover in both scapular protraction and scapular upward rotation. It is a key scapular stabilizer, keeping the shoulder blades against the rib cage when at rest and during movement. The origin of the serratus anterior is the outer surfaces and superior borders of the upper 8 or 9 ribs. An insertion point is the costal surface of the medial border of the scapula. I'll now show you the video of this muscle test. Okay, so this is the serratus anterior muscle test. So we have you sitting for this test. I'm going to have you raise your left arm into flexion of around 120 to 130 degrees with your arm in slight internal rotation and some slight abduction. Do I have your consent to place my hands on you for this muscle test? Thank you. All right, so we'll get you to raise your arm into flexion, about 120 degrees. We're going to have some internal rotation and also just have it slightly out in an abduction, slight abduction. Okay, so for this test, I'm going to place my left hand just here on the lateral side of your scapula, and my right arm is going to be here between your elbow and your shoulder. Okay, I'm going to be applying pressure to the dorsal side of your arm, and I'm going to be applying pressure in the direction of extension, which is lowering. Okay, so just we'll hold that for 5 seconds. You just need to resist my pressure. Okay, you ready? Hold on. Thank you. Okay, the second test that I performed is on the elbow joint. It's the supinator muscle. The main function of the supinator is to supinate the forearm. This can be done with the elbow in any position of flexion or extension. Supinator works with biceps brachii if powerful supination is required. However, biceps brachii is unable to supinate when the elbow is extended. The supinator muscle has a broad origin from the ulna and humerus. The 2 layers of fibers originate in common from the supinator crest of the ulna, the lateral epicondyle of the humerus, the radial collateral ligament, and the annular radial ligament. The superficial layer of the fiber has a tendinous origin and surround the upper part of the radius. The deep layer of fibers encircles the neck of the radius above the radial tuberosity. The insertion, proximal third of the radius on the anterior lateral and posterior surface, distal to the radial tuberosity. You can perform this test in a standing, seated, or supine position. Supinator muscle test is performed to assess the strength and function of the supinator muscle, which is crucial for forearm rotation and upper limb stability. It helps identify weakness nerve involvement or muscular imbalance affecting the supination. Okay, so this is the supinator muscle test. For this test, you will have your arm in full extension behind you with your elbow extended and your forearm in supination. Okay, do I have consent to place my hands on your arm for this muscle test?
Yes.
Thank you. All right, so I'll get you facing forward. We'll extend your shoulder. Your elbow is extended and your forearm is in supination. So for this muscle test, I'm going to put fixation points on your medial and lateral epicondyle, and my left hand will be applying pressure down at the distal end of your forearm, just above your wrist. Now that pressure is going to be in the direction of pronation. Okay, so I'll get you to resist that and we'll hold that for 5 seconds. Just facing forward, ready, and go. Good. Okay, this brings us to the third muscle test. We've moved to the hip joint for this muscle test, and I have chosen to do the lateral rotators of the hip joint. Now, this the lateral rotators are a group of muscles: the piriformis, the quadratus femoris, the obturator internus, the obturator externus, the gemellus superior, and the gemellus inferior muscles. Okay. Now these muscles work together to laterally rotate the hip. All of these muscles originate from the hip bone and insert on the upper extremity of the femur. The muscles are innervated by the sacral plexus, except for the obturator externus muscle, which is innervated by the lumbar plexus. So the piriformis is a thick, flat muscle and the most superficial muscle among the deep gluteal muscles. The muscle leaves the pelvis through the greater sciatic notch and attaches to the superior margin of the greater trochanter. It's shaped like a pear and it lies nearly parallel to the posterior margin of the gluteus medius. The quadratus femoris is a short, flat and rectangular muscle. It is situated inferior to the obturator internus and gemelli. It's striated in appearance and is bordered anteriorly by the obturator externus and posteriorly by the sciatic nerve. The origin is the inferior lateral margin of the ischium along the anterior part of the ischial tuberosity. Its insertion point is the quadrate tubercle of the intertrochanteric crest of the femur and area inferior to it. To that. The obturator internus is the deep muscle of the hip joint, which is part of the lateral wall of the pelvis. It is found in the superior inner side of the obturator membrane. The obturator internus muscle originates from the inferior margin of the superior pubic ramus and from the pelvic surface of the obturator membrane. Its tendon exits the pelvis through the lesser sciatic foramen to insert onto the greater trochanter of the femur. Then we've got the obturator externus, and this muscle is a conical shaped short external rotator located in the outer side of the obturator membrane in the lateral wall of the pelvis. The origin is the rami of the pubis and ischium as well, and the external surface of the obturator membrane. Its insertion point is the trochanteric fossa of the femur. We got the gemellus superior. is a small muscle in the posterior lateral portion of the hip, and it works with the gemellus inferior and obturator internus to form the triceps coxae. It externally rotates the hip, to externally rotate the hip, sorry. Its origin is external surface of the ischium spine, and its insertion is with the tendon of the obturator internus into the medial surface of the greater trochanter of the femur. The gemellus inferior lies inferior to the gemellus superior and the obturator internus tendon. It is a triangle-shaped muscle found deep in the gluteal space. The inferior gemellus joins the superior gemellus and obturator internus as a conjoined tendon. The triceps, which as I said before, classes the triceps coxae. The origin is the proximal part of the tuberosity of the ischium, and the insertion point is with the tendon of the obturator internus into the medial surface of the greater trochanter of the femur. Okay, so the lateral rotators of the hip muscle test is performed to assess hip stability, detect movement impairments, and identify potential sources of pain or dysfunction in the lumbopelvic region. Okay. Okay, so this is the lateral rotators of the hip muscle test. I've got you sitting on the edge of the table with your knees bent over the table. For this test, I'm going to get you to sit with some lateral rotation of the hip. Okay, great. Do I have consent to place my hands on your leg for this muscle test? Yes. Thank you. Okay, so for this test, I'm going to place my right hand laterally here, just above your knee. I'll just get you to widen your head there, thank you. And my left hand will be placed medially on the lower leg, and I'm going to be putting some pressure medially on your leg. I want you to resist that. We'll hold for 5 seconds. Well done. Okay, so this brings us to part 2 of assessment 3, which is the verbal defense section. I was allocated worksheet 9, which is the hip and knee. The worksheet gave us some information stating that the lower extremities provide both support and mobility for the body as a whole. The hip and knee are complex structures, efficient in the performance of many movements, yet vulnerable to an injury because of the many and varied stresses they encounter. This worksheet focuses on 2 particular structures at the hip and knee, the range of motion permitted at these structures and the strength of the muscles responsible for initiating the movement at this joint. The worksheet reminded students that when performing any muscle strength testing, the comfort of the patient and the handling of affected muscles are important factors, and that in some cases the comfort of the patient or the condition of the affected muscles will necessitate some modification of the test position. Now, the worksheet then gives directions for the following muscle tests: the popliteus, the semimembranosus semitendinosus, the bicep femoris, quadriceps, the iliopsoas, the sartorius, tensor fasciae latae, the hip adductors, magnus brevis longus, medial rotators of the hip, the lateral rotators of the hip, gluteus minimus, gluteus medius, and gluteus maximus. Okay, so the popliteus. The worksheet suggested that the patient, or the directions given in the worksheet, was the patient should be sitting. The test is conducted with the knee flexed at a right angle and with the leg in lateral rotation. Suggested that pressure is in the direction of medial rotation. The purpose of the popliteus muscle test is to assess the function and integrity of the popliteus muscle, which plays a key role in unlocking the knee, stabilizing the joint, and supporting rotational control during movement. The semimembranosus and semitendinosus, the directions were that the patient would be in a prone position. The fixation point would be to hold down the thigh firmly on the table, avoid covering the muscle belly of the medial hamstring. The test directions was flexion of the knee with the thigh in medial rotation and the leg medially rotated on the thigh. The pressure suggestion was against the leg, proximal to the ankle, in the direction of knee extension. There was an important note here to not apply pressure against the rotation component. The purpose of testing the semimembranosus and semitendinosus muscles is to assess knee flexion strength, hip extension capability, and posterior medial knee stability, especially in cases of injury, imbalance, or functional limitation. Okay, then we tested the bicep femoris. The directions here were that the patient was again in prone position. The fixation point was to hold down the thigh firmly on the table, avoid covering the muscle belly of the medial hamstring. To test, we have flexion of the knee with the thigh in slight lateral rotation and the leg laterally rotated on the thigh. We applied pressure against the leg, proximal to the ankle, in the direction of knee extension. Again, another note to not apply pressure against the rotation component. The purpose of the bicep femoris muscle test is to assess lateral hamstring strength, knee flexion capability, and posterior lateral knee stability, especially in cases of injury, imbalance, or functional limitation. Okay, the quadriceps, the rectus femoris and vastus muscle group. The patient would be sitting with their knees over the side of a table and holding onto the table. The fixation point here would be to hold down the thigh firmly on the table. The examiner also is to put a hand under the distal end of the subject's thigh to cushion that part against the table pressure. To test, full extension of the knee joint without rotation of the thigh, and pressure would be placed against the leg above the ankle in the direction of flexion. The purpose of this test is to specifically the rectus femoris and vastus muscle group, is to evaluate knee extension strength, hip flexion capability, and lower limb stability, especially in rehabilitation, injury prevention, and functional movement analysis. The iliopsoas, the psoas major, psoas minor, and iliacus. The patient would be in a supine position. Fixation would be stabilizing the opposite iliac crest. To perform the test, we need the hip in flexion in a position of slight abduction and lateral rotation. Pressure then would be applied against the anterior medial aspect of the leg in the direction of extension and slight abduction. The purpose of the iliopsoas muscle test is performed to assess hip flexion strength, detect lumbar pelvic dysfunction, and identify potential sources of anterior hip or lower back pain. Okay, the sartorius. Again, the client would be in a supine position. To perform the test, the client would have a lateral rotation, abduction and flexion of the thigh with flexion of the knee. Pressure would then be applied against the anterior lateral surface of the lower thigh in the direction of hip extension, adduction and medial rotation, and against the leg in the direction of knee extension. The purpose of the sartorius muscle test is to assess hip and knee coordination, detect muscle imbalance or strain, and evaluate functional movement patterns involving flexion, abduction, and rotation. The tensor fasciae latae. The patient would again be in supine position. Fixation point could be the patient must hold onto the table for support and stability. To perform the test, the client would be in abduction, flexion, and medial rotation of the hip with the knee fully extended. The pressure would then be applied against the leg in the direction of extension and adduction. The purpose of the tensor fasciae latae muscle test is to assess hip flexion, abduction, and internal rotation strength, as well as detect imbalances or tightness that may contribute to lower limb dysfunction or pain. The hip adductors, the pectineus, gracilis, adductor magnus, brevis longus. The patient would be lying on the right side to test the right and left to test the left, with the body in a straight line and the lower extremities and lumbar spine straight. Fixation, we would hold the upper leg in abduction, patient to hold the table for stability. To perform the test, the adduction of the underneath extremity upward from the table without rotation, flexion or extension of the hip or tilting of the pelvis. Pressure would then be applied against the medial aspect of the distal end of the thigh in the direction of abduction. The purpose of testing the hip abductors, the pectineus, gracilis, and adductor magnus, brevis, and longus, is to assess medial hip strength, detect groin-related dysfunction, and evaluate lower limb stability during movement. The medial rotators of the hip, the tensor fasciae latae, gluteus minimus, and gluteus medius. The patient is sitting with the knees over the side of a table and holding onto the table. The test is performed with medial rotation of the thigh. Pressure with one hand against the medial side of the lower end of the thigh, with the other hand against the lateral side of the leg above the ankle, pushing the leg inwards in an effort to rotate the thigh laterally. The purpose of testing the medial rotators of the hip are primarily the tensor fasciae latae, gluteus minimus, and anterior fibers of the gluteus medius, helps assess hip stability, neuromuscular control, and movement symmetry, especially during gait and single leg tasks. The lateral rotators of the hip, which include the piriformis, the quadratus femoris, the obturator internus, the obturator externus, and the gemellus superior and gemellus inferior, as highlighted in part 1 of this assignment. The patient is sitting with the knees bent over the side of the table and holding onto the table for stability. The test then is performed with a lateral rotation of the thigh, the hip. Pressure then is, one hand is against the lateral side of the lower end of the thigh, the distal end of the thigh, with the other hand against the medial side of the leg above the ankle, pushing the leg outwards laterally in an effort to rotate the thigh medially. The purpose of testing the lateral rotators of the hip helps assess external rotation strength, hip joint stability, and potential sources of posterior pelvic or sciatic pain, especially in movement screening, injury prevention, and rehabilitation. Okay, the gluteus minimus. The patient is lying on their side, and we're stabilizing the pelvis. The test is performed with abduction of the hip, and pressure is applied against the leg near the ankle in the direction of adduction and slight extension. The purpose of the gluteus minimus muscle test is performed to assess hip abduction and internal rotation strength, evaluate pelvic stability, and identify dysfunction that contributes to gait abnormalities or lateral hip pain. The gluteus medius, patient again laying on their side with the underneath leg flexed at the hip and knee. Fixation, we stabilize the pelvis. The test, the patient would have abduction of the hip with slight extension and external rotation. The pressure would then be applied against the leg near the ankle in the direction of adduction and slight flexion. The purpose of the gluteus medius muscle test is performed to assess hip abduction strength and pelvic stability, especially during single leg stance and gait. It helps identify weakness, asymmetry, or dysfunction that may contribute to lower limb injuries or movement impairments. The last muscle test performed on this worksheet was the gluteus maximus. The patient for this muscle test would be in a prone position with the knee flexed at 90 degrees or more. Fixation would be posteriorly on the back muscles and laterally on the lateral abdominals. For the test to be performed, the hip would be in extension with the knee flexed. Pressure would then be applied against the lower part of the posterior thigh in the direction of hip flexion. The purpose of the gluteus maximus muscle test is performed to assess hip extension strength, evaluate postural control, and identify dysfunction that may contribute to lower back pain, gait abnormalities, or athletic performance deficits. Okay, as part of this worksheet, we performed these muscle tests and graded the muscle tests. The grading helps to differentiate between neurological, muscular, or joint-related deficits, and it provides a standardized way to monitor changes over time, whether a patient is recovering from injury, surgery, or managing a chronic condition. As you can see from the chart on the screen, the grading is worked out as follows. The grading is from 0 to 5. Grade 5 would be normal, class as normal, full range of motion or movement against maximal resistance, with the functional implication of full strength for daily and athletic tasks. Grade of 4 indicates good, full range of motion or movement against moderate resistance. And the functional implication is that it can perform most functional tasks. A grade of 3 indicates fair, full range of movement, motion against gravity only, and the implication is basic movement with some limited endurance. A grade of 2 indicates that it's poor, full range of movement and motion in gravity eliminated position. Implication is that it needs support or assistive strategies. A grade of 1 indicates trace, a flicker of contraction but no movement, minimal activation, no functional use. And a grade of 0 means no contraction, that there was a complete loss of function. So as you can see here on the right side is the completed grading scale for the client or participant that I used to perform the muscle tests of this worksheet, and their grading scores of each muscle have been highlighted in yellow. All of the muscle tests performed were graded as a grade 5 or grade 4, so either good or normal, except for the hip adductors, which both showed a grade of 3. However, there was some maybe lack of confidence on my behalf in knowing whether I performed the test correctly, given that all of the other muscle tests grading was considered normal. There was a question there as to why they were showing as grade 3. This scale and grading system is rooted in the original Lovett and Martin method from 1916 and has been refined through decades of research and clinical application. And this brings me to the end of my presentation, and there is a list of the references that I used for this assessment. Thank you for watching.